Hello everyone. We daily encounter patients with the chest pain in our day to day practice. Only worry for the patient and attending physician is whether this pain has been attributed to the cardiac cause. So, we have a score called as heart score HEART that takes various clinical ECG parameters and troponin levels for the risk stratification for the pain being whether low, moderate, and high risk, and what is the risk of near future development of major adverse cardiovascular events. So, H stands for the history. If depending on the character of the pain and duration and patient background, if clinically it is high suspicious, moderate suspicion, and low suspicion for the pain being of cardiac origin. So if it is high suspicion, 2 point, if it is moderate suspicion, 1 point, and low suspicion or no suspicion of cardiac origin, it is 0 point. Then comes is the E is the ECG parameter. So if there is significant ST deviation, it is given as the 2 point. If there are non-specific STT abnormalities or repolarization abnormalities or LVBB, it is given as the 1 point. And normal ECG, it is 0. Then comes the age. If patient's age is more than 65, then it is given as 2 point. If age is 45 to 65, it is given as the 1 point, and less or equal 45 is 0. Then comes the risk factors. Presence of 3 or more risk factors, it is given as the 2 point. 1 to 2 risk factors, it is given as the 2 point, and no risk factors, it is 0. Then comes the T. T is the troponin levels. More than 3 times of the upper limit, it is given as the 2 point. 1 to 3 times of the normal limit, it is given as the 1 point, and less or equal 1 times or normal, it is given as the 0 point. So the total score is 10. Out of 10, if the score is 0 to 3, it is the low risk. If 4 to 6, it is the moderate risk, and 7 to 10, it is the high risk for the development of the major adverse cardiovascular events. So 0 to 3, we may discharge the patient. 4 to 6 may need further cardiac evaluation, and 7 to 10, it is the high risk. They need hospitalization and further evaluation, cardiac workup such as echocardiography or coronary angiography, etc.